All right, let's jump right into this explainer. Today we're unpacking a really pivotal piece of internal research from the Care Quality Commission, or the CQC. If you're not familiar, they're the independent regulator of health and adult social care over in England. Their whole job is making sure care services provide safe, effective, and compassionate care. But recently, they decided to turn the magnifying glass on themselves. They asked a really critical question. How do you actually move an entire organization from just being aware of racism to actively dismantling it? It's a fascinating, data-driven look at that exact journey.
Here's how we're going to break this down today. We'll start off with racism in healthcare today, then look at how they co-designed this research and dig into the gap in understanding they found. After that, we'll cover the culture and internal barriers, reforming regulatory practice, and finally, how they plan to move from intent to action.
Okay, Section 1, Racism in Healthcare Today and the Context of Inequality. To really get this, we've got to look at the wider health and care sector in the UK, where modern systems, frankly, still reflect historical, racialized inequalities.
The data is incredibly clear here. Generalized equality frameworks just aren't cutting it anymore. Just look at the numbers. In 2024 to 2025, detention rates under the Mental Health Act were significantly higher for Black and Black British people than any other demographic. In maternity care, Black women are facing disproportionately poor outcomes, which includes higher risks of mortality. And it affects staff too. The Royal College of Nursing reported a massive 55% spike in racist abuse directed at healthcare workers. These aren't just isolated one-off incidents. They're deeply ingrained systemic patterns, and it absolutely forces organizations to explicitly adopt an anti-racist approach. Why? Because traditional race-neutral policies literally fail to address the structural drivers causing these uneven outcomes.
So, Section 2, Co-designing the research and centering lived experience. Let's see exactly how the CQC set up their methodology to examine their own internal and external role in all of this.
Now, what makes this report so compelling is how they actually built it. This wasn't some sterile corporate audit that they just outsourced to a traditional consulting firm. Not at all. It was a deep, deliberate partnership with PPL, the Race Equality Foundation, and National Voices to ensure that real lived experience guided every single step of the way. They utilized the 8 stages of the Lloyd-Evans Participatory Action Research model, meaning they didn't just extract data from their employees. Instead, they formed a co-design group made up of 12 individuals. These were people with actual lived experience of racialization, a mix of CQC colleagues and external provider representatives. Together, they collaboratively shaped the core questions, conducted peer-led interviews, and analyzed the data themselves. It's a really great way to equalize the power dynamic between researchers and participants.
And this brilliantly illustrates the benchmark that the group set. They co-developed the specific working definition of anti-racism. I want you to really notice the language here. They explicitly define anti-racism not as some passive state of mind, but as courageous, measurable action. It's about actively confronting and changing systems. It requires commitment. It requires accountability. Essentially, they're framing it as an active verb, not a noun.
Moving on to Section 3, the gap in understanding, or intent versus reality. So, how did the 355 CQC colleagues who responded to this massive internal survey actually measure up to that active definition we just talked about? We'll look at the stark contrast here between individual awareness and the reality of a fractured organizational understanding. It's pretty wild. 94% of people feel highly confident that they personally understand race and racism. But then, when they were asked if the organization as a whole shares an understanding of anti-racism, that number plummets to just 56%. So what does that tell us? It shows that while individuals might have the right vocabulary, the organization completely lacks a unified language and consistent leadership direction to turn all that personal awareness into actual collective action. That brings us right to Section 4, Culture and Internal Barriers. Specifically, we're talking about the massive problem with psychological safety.
Because that gap we just saw between individual knowledge and collective action, it stems largely from organizational culture. In fact, the survey pinpointed culture as the absolute biggest barrier to progress. The Pulse survey data revealed a really jarring statistic. Only 24% of colleagues feel that action is actually taken when they speak up. Think about that. A massive majority of the workforce feels that raising a concern essentially just goes into a black hole.
Take a look at this quote from one of the focus group participants. They powerfully highlighted how low psychological safety and real fears of retaliation basically cripple any open discussions about racism. When microaggressions go unchallenged because people are terrified of being labeled difficult, or when leaders are just too scared of getting it wrong, the reporting systems break down entirely. The direct result of all this is that leadership engagement is perceived as totally inconsistent. Anti-racism ends up operating alongside core processes, kind of like a side project, rather than being deeply embedded right into everyday decision-making. People are seeing the generic statements on the internet, sure, but they aren't seeing the sustained, accountable action backing those statements up.
Let's look at Section 5, Reforming Regulatory Practice and the External Impact. The crucial point here is how all this internal friction impacts the CQC's actual day job, regulating health and care providers.
Think about it. If the regulator is struggling internally, how does that affect the hospitals and care homes they inspect? Because anti-racism isn't clearly built into the regulatory guidelines, inspectors are facing massive barriers out in the field. Right now, it's implicit, not explicit. This means inspectors often lack the specific training and the granular data they need to spot systemic racism during a quick site visit. And without explicit guidelines on what good anti-racist care looks like, inspectors just have to rely on their own individual judgment. Naturally, this leads to huge variability during inspections, which is confusing for the providers and ultimately totally ineffective for the public.
You can clearly see the disconnect between policy and reality right here. In terms of policy, an inspector might just check if a clinic has an equality, diversity, and inclusion statement on file. But in reality, care providers report that this just feels like a superficial tick-box exercise completely disconnected from actual patient care. And as long as the metrics rely on superficial checks like an EDI statement, the regulatory process is going to completely fail to dismantle actual racial inequity in the real world.
Finally, we arrive at Section 6, From Intent to Action, looking at the priority areas. So, what are the co-design group's actionable solutions for shifting the whole organization from just talking to actually doing? The great thing about this report is it doesn't just point out the problems, it isolates 3 overarching sequential priorities. Step 1, you have to fix the internal house first by improving internal systems. Step 2, you strengthen regulatory practice outward. And step 3, you must invest in the long-term support and infrastructure. To make absolutely sure these aren't just temporary flash-in-the-pan initiatives, but normal, sustainable business operations.
So here's what that actually looks like in practice. By embedding concrete actions into their governance, like defining explicit regulatory standards for what good and poor anti-racist care actually means, and completely reforming internal recruitment to remove those middle management bottlenecks, the CQC can start enforcing real accountability. They also highly recommend mandating psychologically safe reporting routes, allocating actual dedicated budget to this work, and most importantly, continuing to co-produce solutions directly with lived experience groups.
Which brings us to our ultimate takeaway. Right now, the CQC is essentially in Phase 1, naming racism. But as this explainer reveals, good intentions and nice public statements just aren't enough. It requires structural, accountable, and yes, sometimes very uncomfortable action. It leaves every single one of us to ask, is your organization truly doing the hard, measurable work to enact systemic change, or are you guys just ticking a box? Thanks so much for joining me on this deep dive, and remember to keep asking the tough questions.